Good afternoon, everybody. Thanks for joining us today. I'm stepping into Emmeline's shoes this afternoon. I'm joined by Nicole Bennett, who is a prosthetist and orthotist at Pace Rehabilitation. By way of background, Nicole spent 7.5 years as the lead orthotist at Headley Court, running the MOD's only orthotic service, and Nicole joined Pace in June of this year. So as regular viewers will know, we've only got 15 minutes, so we'll get started right away. Nicole is going to be speaking to us today about the contemporary approach to the age-old limb salvage dilemma. So to get started right away, Nicole, what is the dilemma with limb salvage?
Well, I think whether we're clinicians or like yourself, Chris, a solicitor working with people who have had a catastrophic injury, it's difficult to ignore the plight of limb salvage patients. Usually these individuals have quite a lot of physical issues post-injury and obviously psychological as well. It's a long road to recovery for somebody who's had limb salvage.
Yeah.
Typically they're in and out of X-fix frames, rehab is lengthy, they have various different surgeries along the way, metal work has to come out. So it's really difficult for those individuals to get going with rehab because they constantly have surgical interventions. It can be very painful when they start weight bearing, and once they eventually get to that stage, there are problems sometimes with scar tissue, infection. So there can be a lot to contend with for limb salvage patients, which makes it very difficult to treat. It makes it very difficult to make rehabilitation gains. And research has showed that there's quite a significant difference in terms of clinical outcomes between limb salvage patients and those, for example, who have elective amputation. And military studies have shown that usually it's those that have limb salvage that have the worst clinical outcomes, both functionally and psychologically, compared to amputation. So it's quite a difficult, so much work and so much time and effort on this, the clinician side, as well as more importantly, the patients is invested in keeping this limb. But what is left is sometimes a limb that is, not particularly functional, incredibly painful, and can be very difficult for that patient to move forward. I think sometimes one of the problems is that, trying to get a timely outcome can be really, really difficult.
So as an orthotist, would you specialise in complex trauma like this? Is it a discipline within your discipline?
Yeah, I think most orthotists are generally trained. So you kind of work in a variety of different areas. So you work in trauma, you work in neuro, but I think it's really important to try and find an orthotist who has an experience in complex trauma, because I think complex trauma patients require sometimes a little bit of an unorthodox approach. And what I mean by that is that quite typically as orthotists, we are trained to start minimally. So, certainly you'd want to brace parts of the limb where you have functional loss. And if you have some stability and you have some power in your limb, you would want to, allow the limb to do the job for itself. You certainly wouldn't want to overbrace somebody. When it comes to complex trauma, for example, I think sometimes you have to be a little bit more overzealous. And sometimes you're kind of trying to win hearts and minds a little bit more. So sometimes you have to provide something which is maybe technically overbracing somebody to give them that big functional boost, that big pain boost to kind of get that buy-in quicker. Because quite often with these individuals, if they've gone through years and years of treatments and surgeries, if you don't make functional gains quickly, sometimes you have lost that heart and mind. And it's those individuals that quite often go on to elective and elective amputation, that is, and don't continue down the path of limb salvage. So I think it's important to try and find an orthotist and a rehabilitation team who are well versed in complex trauma, who are able to manage that well.
And what sort of orthotic solutions might you look at early on when you're in this situation, looking at limb salvage?
Well, orthotics can sometimes be seen, I guess, as the end of the road. So sometimes by the time somebody comes to an orthotic department, they've kind of had all their surgeries, they've had lots of different therapy in and out, and eventually they kind of end up in an orthotic clinic, and it ends up being sometimes a last ditch attempt to kind of gain function before, you know, sadly maybe an individual does progress onto elective amputation. I guess what I would say first and foremost is it'd be great if we saw these individuals sooner. So it'd be great if we can get hold of these individuals before they get to that point to try and get those functional gains sooner. And there's so many different ways that an orthotist can help. So an orthotist can deal with compression garments, can deal with scar management garments, contraction devices, insoles, AFOs, lots of different things that can be used along that rehabilitation journey. So they're quite an integral member of a multidisciplinary team. It's also quite important that the MDT team that's working with the orthotist is working together. Quite often it can be advantageous to be working with physiotherapists, who have experience, for example, in prosthetics. It's that man and machine coming together. So that can be really advantageous. And there are some devices that are starting to come more into light, which are, I guess, are technically called passive dynamic AFOs. And they have different commercial names. So you may be aware of or have heard of things called the momentum brace or the reactive brace. And these type devices can be really useful for this particular patient group. It comes back to the point I was making about being a little bit more gung-ho in terms of supporting that limb to try and get good functional outcomes. And these devices have been used extensively within the military and are now used much more with civilians in terms of getting really good results for people who have incredibly painful limbs with lack of function. In terms of how it works, it kind of offloads the foot and the ankle. So what it tries to do is the framework of the device takes some of the forces that are being, as you're walking, kind of forces that are kind of passing through the ankle, then pass through the system, low down below the knee to try and kind of offload the foot and the ankle. And it also has a kind of posterior blade at the back, which I guess works quite similarly to a prosthetic blade, where it's trying to kind of give back propulsion and the whole system's trying to take some of the stresses and strains that go through the ankle. And that could be a really good way to get somebody functional quicker and kind of get on top of the pain. And if you can do that, someone can start moving forward with their rehab and start feeling like they're getting a little bit of themselves back. And then sometimes you can take from there and you can start to work backwards, which is slightly different than orthotists typically do, where you tend to kind of work minimally and work up. Sometimes it's good to start there and then try and tail that back so that you are using the patient's muscles as much as possible, but you get that kind of big win to start with to allow someone to start getting a bit of life back. And these devices can be really, really useful. And studies have shown that the use of these devices has reduced elective amputation rate within the military and has improved functional and psychological outcomes also in civilians and in the military. And certainly we found when I was working at Headley that of the individuals who came to us seeking elective amputation, we were able to, on average, 25% of those patients having used this device chose to continue with limb salvage rather than go down the elective amputation route. So it's not the answer for everybody, but it does, you know, if 1 in 4 people continue down that road to keep their limb, that's obviously for the win. And these devices can be very useful. Also, if somebody, for instance, is thinking about elective amputation, but it's just not the right stage in their life. So whether it's they're having a family or whether they're getting involved in different university or academic pursuits and it's just not the right time, sometimes some of these kind of hybrid prosthetic orthotic devices can be really good for just pushing that down the line and just allowing someone to be a little bit more functional. And I think the other thing that I would say is that sometimes, and again, I come back to elective amputation because that's kind of one end of the scale. Sometimes people can come to us and they're thinking about elective and the kind of thought process is, well, there's no point in trying this particular brace because, well, you know, that's the way I'm going to go. But I guess what we found in clinic and what we also saw working with military personnel is having a device like that, obviously it might be effective. It might actually stop that individual from going on to elective. But if it doesn't, it wasn't a lost exercise. Because that all during that period when they have that orthosis, they can engage in functional rehab so much better. You know, they can start to work on their gluteal muscles, their kind of proximal control. They're able to potentially, whether it's ditch both walking aids or progress onto one stick rather than 2, all of these functional gains will help that individual. So instead of going from here to an amputation, you're kind of functionally up here to an amputation. And that's a much easier transition to make.
Yeah, so I guess it's about kind of turning it on its head a little bit, really, isn't it? And rather than you coming in right at the end, get you in as soon as you can, and then you know, if you can make those gains, great. And if they don't need to go to elective amputation, fantastic. But where they do end up going for elective amputation, you've set that groundwork, you've done the prehab, and they're in a better position for having seen you earlier.
Yeah, no, most definitely, and we see that quite often. It's not wasted time.
So what would you say the goals are for you with orthotic treatment when you're coming in with that limb salvage question? What are your goals?
Yeah, I think the different things that I would be looking at, obviously function. So we want somebody to be more functional and more independent. We want to manage pain, because pain is usually always a factor. Very rarely is it not. So we'd want to try and improve pain. Now, whether that's through immobilizing certain joints within a brace, whether that's through with our physiotherapists and team here, whether they can have an input to that, but trying to manage pain. We'd be looking at scar tissue, we'd be looking at scar management. So, you know, trying to whether it's hands-on work with that or different garments and various things that individuals can use. But holistically, we'd be trying to look at the big picture. But the key big things that we'd be trying to work on is function and pain, because that's the things time and time again that, you know, they're the things that people have the biggest difficulty with when they come in to see us here for a prosthetic and orthotic assessment. And they are the things that we're trying to tackle with these different orthotic devices. And it's just understanding that orthotics is such a wide, varied speciality, and we can help in so many different ways as an orthotist. That when it comes to complex trauma, an orthotist should always kind of be part of that multidisciplinary team. Yeah,
absolutely. I think definitely the take home for me is that it's sooner rather than later, not sitting back and waiting to bring the orthotist in at the end and seeing what progress you can make. And this is a really big subject. I'm sure you could speak about it for hours, but I think that's really fantastic snapshot of your role and what you bring to the MDT at Pace, and working with those people that are considering whether to progress towards amputation or see if their limb can be salvaged. So thank you for that, Nicole. It's a really great insight. I don't think we've got much more time to go into that, but if anybody does have any questions, I'm sure if you want to send them in by email, then I can pass those on to Nicole, and I'm sure she'd be happy to deal with those for you. Just to say before we do wrap up, the next episode of Soundbites is on the 15th of September. If you want to get your Soundbites fill in the meantime, you can catch up with the previous episode filmed with Pace Rehab on the on-demand section of the Stewarts website. Otherwise, until then, you can see the next live Soundbites on the 15th of September. So thanks, Nicole.
Thanks, Chris.